It's a moment in time we all hope will never happen to our loved ones. But for many of us, due to illness, injury, or age, someone we care about will, one day, need more help than we can give. For some, assisted living or a nursing home is a viable option. But for many of us, those options are a last resort.
When I would call for somebody, it could be 30 minutes or longer before anybody would come, because they really don't have enough people on hand.
We want our loved ones to remain where they are, yet we know we need outside support. But the thought of having a stranger come into our or our loved one's home to provide home care can be intimidating. Who do I call? What qualifications should I look for? Who can I trust? That's where professional healthcare services can help. Penny Byram, founder of PHCS, was raised in the Philippines by her grandparents, who taught her a strong work, philanthropic, and religious ethic. That same ethic is the foundation for the company's success. Penny's commitment to providing services beyond expectations, coupled with her extraordinary passion to care for her clients and their families, has helped PHCS become one of the premier healthcare providers on the West Coast. For more than a decade, PHCS has been providing qualified caregivers, including nurses' aides, homemakers, home health aides, and companions in the hospital or for homebound patients.
Healthcare is very personal. It's personal to each and every one of us. It's personal when we talk about our loved ones.
That personal approach is what sets PHCS apart. The key is compassion.
Well, one of the things a company should have is compassion. And you don't have that with every organization. Some of them are just very clinical. And I see that the people at Professional Healthcare do care. And they are some of the most compassionate people I've ever dealt with.
Our English-speaking caregivers are available 24 hours a day, 7 days a week, on an hourly, daily, or live-in basis. From meal preparation and light housekeeping to physical therapy and hospice support, our trained personnel ensure your peace of mind.
I was looking for somebody who could, number one, could handle my husband physically, and that could get along with both my husband and myself. I called them on a referral and was very pleased the whole time.
The advantage is having one person that you really like that works with you.
But they sent somebody who is proficient on getting a patient used to having somebody come when they haven't been used to them before, so that they would get used to the idea that there was somebody going to be there with them, and which helped a lot.
At PHCS, your peace of mind is our highest priority. That's why each of our caregivers goes through a comprehensive screening process, as well as a comprehensive training and safety program. At PHCS, all of our employees, caregivers, and nurses are not only licensed, bonded, and insured, but also have spent time as a caregiver themselves.
We teach a 10-part class that covers everything from stroke victims, Alzheimer's. We include CPR.
The company here goes to great lengths to train their people before they ever put in anybody's house. This is, you hire somebody there to take care of somebody the next day. That doesn't happen.
Also, I was very, very pleased not to have to handle the financial end of it. I paid a fee to the agency, and they took care of insurance, taxes, all that.
And our rates are highly competitive as well, so you won't have to deny your loved ones the best possible care. But being a qualified caregiver is just the beginning. We know that we have to provide a caregiver with whom both you and your loved one can feel comfortable. That's why with PHCS, you will have the opportunity to meet and interview any caregiver